Thank you, Toastmaster of the Day, fellow Toastmasters, and honored guests. The title of my speech is My Patients Say the Silliest Things. I got the idea for this speech after doing something that I haven't done in almost 5 years. A few weeks ago, I was the featured speaker at an in-person Toastmasters meeting. In our club, we've been doing Zoom all these years, and I haven't had an in-person speech in years. So it was a surreal experience. It was a blast from the past. It was it was like going back in time. So right away, when I started speaking, the first thing I noticed is that I had to start making eye contact with people in the room. And now we're all used to making eye contact with the camera, but it's different in real when you're doing a real speech in front of people. You have to make contact with the people in the room. At one point, there was a woman who was the timer, and she started making some movements with her hands, and it distracted me. I lost track of what I was saying, but I was able to recover and finish my speech. So right away, this was a disconcerting experience, not what I was used to. Later in the meeting, they invited me to do a table topics question, and my question was, Dr. Dubin, we hear you're a comedian. So I took that as my invitation to tell some jokes or tell some funny stories. But guess what? My mind went completely blank. I could not think of one joke or story to tell. And all these people were looking at me and I was trying to look back at them and I just kind of babbled for a minute and sat down. I was totally humiliated. Then about 5 minutes later, I started thinking of all these funny stories of patient encounters I've had. So I didn't want to waste all these thoughts and funny stories. So I decided to make a speech, and that's what this speech is today. My patients say the silliest things. The first story that came to mind was when I was working in an emergency room years ago, and I came into the patient's room. The patient happened to be a gas station attendant. Now, in those days, when you went to a gas station, you weren't allowed to pump your own gas. They had an attendant that would pump the gas for you. So this fellow came in. I greeted him. I said, "Good day, sir. What brings you to the emergency room?" So he says, "Well, doc, I was pumping some gas and the hose got out of my hands. I got gasoline all over my hands. I didn't have time to wash off the gasoline because I had a bunch of other cars to fill. So I finished those cars and then I went to the bathroom to wash my hands. When I got to the bathroom, I had to pee so bad that I didn't get a chance to wash my hands. So I went to pee and I got gasoline all over my private parts." I said, "Oh, that's terrible." He said, "Yeah, it's terrible. And now, a week later, I have all these blisters on my private parts." I said, "Oh, okay. Well, maybe he had an allergic reaction to the gasoline. I never heard of that happening, but maybe that happened." I said, "Okay, well, let me take a look." So he pulls down his pants. I see all these blisters. I said, "Wow, yeah, that must be an allergic reaction." Then I look closer and I see this green discharge. I said, "Wait a minute, I've seen that before. That's gonorrhea. So these blisters must be herpes." So I said, "Okay, guy, I know gasoline didn't do that. Tell me what really happened." So then he admits that a prostitute came to the gas station and he had unprotected sex in the bathroom. I said, "Okay, that makes sense." So I gave him treatment for gonorrhea and herpes and he was on his way. It was at that time that I realized for the first time that my job as a doctor was similar to a police detective. As a doctor and police detective, you look for clues and you both have people lying to you. That's my first story. The next story I remember is I was again working in the emergency room and I go into a room to see a woman, a middle-aged woman. I introduce myself. "I am Dr. Dubin. What brings you to the emergency room today?" And she says, "Doctor, I'm having this severe pain." I said, "Oh, I'm sorry to hear that. Where are you having pain?" He says, "I'm having pain all over my body." I said, well, can you be a little more specific? She said, yes, I'm having pain in my head, I'm having pain in my neck, I'm having pain in my chest, in my arms, my feet, I'm having pain everywhere. And I want you to order x-rays for my entire body. I said, well, we can't do that. If you have pain in a specific area, we can do an x-ray, we can do some blood tests, but we can't just x-ray your whole body. Then she says, well, I want you to x-ray my entire body, and if you don't, I'm going to put a curse on you. I said, what? You're going to do what? And then she opens her eyes, looks straight at me, and says, consider yourself cursed. So I'm taken aback. I go out of the room, and the nurse says, what's wrong? What's wrong? I says, this patient just put a curse on me. What am I going to do? He says, well, this is a Catholic hospital. You can go to the church office next door and they can take the curse off of you. I said, yeah, that's a good idea. I'm going to go over to the church office. So go to the church office, and as you would know, as you might have guessed, there were no priests there. So I start heading back to the emergency room, and on my way there, I run into one of the priests in the hallway. So I go up to him, and I say, Father, can you help me? This patient put a curse on me. Can you do an exorcism or something? The priest looks at me and smiles and walks away. So to this day, as far as I know, I still have a curse on me. My patients say the silliest things. Years later, I was working in my office and I was seeing a patient that I hadn't known very well. It was an 80-year-old woman. I probably had seen her once before. And I'm talking to her, I'm examining her, don't really find anything wrong. I say, well, you're doing fine. I'll just see you in another 6 months. And she says, fine. I said, if you have any problems, give me a call. About a week later, I got a message from this 80-year-old lady saying that she wanted to talk to me about her medication. I call her and she says, doctor, I used to be on aspirin, but I'm not taking aspirin anymore. I wonder if I could start taking aspirin again. I said, yeah, sure, that sounds fine. She then says, oh, by the way, there's something else I want to talk to you about. I said, okay, what's that? Said, well, when I was in your office the other day, something strange happened, and it's been bothering me for the last week, and I just want to talk to you about it. I said, okay, what is it? What happened? Said, well, this is an 80-year-old lady now. He said, well, uh, when I was in your office last week, you touched the inside of my thigh, and I was sort of kind of surprised, and I kind of wonder why you did that. So now I'm thinking, oh my God, this is the most ridiculous thing I've ever heard. She said, so maybe I'm thinking, well, maybe my stethoscope touched her thigh, or I accidentally brushed her thigh with my hand. I said, what could you be talking about? So I say, okay, well, what do you mean I touched your thigh? Did I touch your thigh with my stethoscope? Did I touch your thigh with my hand? What happened? He said, no, Dr. Dubin, you touched my thigh with a sexual toy. And I'm thinking again, this is the most ridiculous thing I ever heard. Even if I did keep a sexual toy in my office, I'm not going to use it on an 80-year-old woman. So I say, okay, I don't think anything like that happened. Maybe you're thinking about another doctor. Maybe you're confused about this. She said, no, Dr. Dubin, it was you. You touched my thigh with a sexual toy. And I figured maybe you were just having a bad day. And I know you're a good doctor. And I know that's not something you would normally do. I know you went to Harvard, but you touched my thigh with a sexual toy, and I would like an apology. So right now I'm thinking, okay, I can't apologize to you for something that didn't happen. And she says, yes, it did happen, and I want an apology. So this went back and forth about 10 minutes. I said, okay, well, we're not getting anywhere, so I'm going to hang up now. So after this bizarre conversation, I sat there for a few minutes. I said, okay, this could be a problem. So I called a lawyer, a friend of mine, and told him what happened. After he stopped laughing for 5 minutes, he said, well, this lady's obviously delusional, but if you fire her from your practice, she may get very hostile and write a letter to the medical board, and you have to go to a hearing, and they would follow it, and it's just a mess. So you should probably just ignore her, and probably she won't she won't come up for her next 6 months appointment. I said, great, that's a good idea. I'm just going to ignore her, and she won't show up. Sure enough, 6 months later, she shows up for her appointment. This time, I go in there with a witness, and I say to her, I'm really surprised that you showed up for this appointment after you said I did these terrible things to you. And she just kind of sat there in silence. And I said, well, I really don't think I can see you as a patient anymore because the kind of things you said I did to you. And she gets up and she says, well, God knows what happened. And I don't need a cardiologist anymore anyway, so I'm leaving. My patients say the silliest things. In summary, what lessons can we learn from these stories of my patients saying silly things? First of all, if someone tells you a story that doesn't make sense, you should look for clues to uncover the truth, like a good detective or a doctor. Secondly, if I would recommend that you not be alone with someone of the opposite sex that you don't know that well. Who knows what they might say about the encounter? I never saw that coming in my case. And thirdly, if someone threatens to put a curse on you, run because a priest or no one else is going to help you. Thank you, Toastmaster of the Day.
Thank you, Dr. Dubin. I see that I don't look like I'm on the camera, which is interesting because I didn't do anything that I know of, and my camera just has turned off. And let me turn it